Well, these photos certainly tell a story. With the latest technologies, you can get amazing results when treating for vein disease. But how do you know when vein disease should be treated?
And are your symptoms being evaluated properly? Let's ask Dr. Deborah Manjoney of Wisconsin Vein and MediSpa this morning. Thanks for being here this morning. During the commercial break, we wanted to clear up a little vocabulary, little words, and because I was looking at venous disease, but it's actually venous.
Like the statue Venus, and that's what we should think about. You know, if you want to look beautiful, perhaps, and fix these problems in your leg.
And it's superficial as well as the deeper veins that we're talking about.
That's correct, because both can give symptoms. And certainly the deep veins are the more important veins. They carry about 90% of the blood return from the legs back to the heart. The veins are those vessels that return blood to the heart. And so the deep veins are very important. You can have life-threatening problems if you have a problem with your deep vein. But superficial veins are the ones that usually give varicose veins.
And I'm glad we're talking about the medical part of doing your veins, because a lot of it is just aesthetics. You want to look good, but there is vein disease. How do you know the difference, and how do you know when you have a problem?
Well, anybody who has varicose veins could actually eventually develop a problem. About 20% of people who have varicose veins across the board will develop ulcers or open sores in their legs at some point later in life because of the high venous pressure that's in the legs when these varicose veins are left untreated. But for the most part, before that happens, people start to have symptoms.
Like what?
So symptoms of leg aching, especially if you're standing or sitting for prolonged periods of time, being inactive and having the ache.
And is it all over aching, or just where the vein is?
Generalized aching or where the vein is.
Okay.
You can have a throbbing sensation where the vein is. You can have restlessness in your legs at night or when you sit down. Fatigue, real leg fatigue. People don't realize that that's not normal. You know, if they're working around and doing normal activities and you're 35 or 40 years old, it's not normal to have tired legs at the end of the day. Swelling in the legs is another thing. And then at night, leg cramps are another big symptom that people don't realize.
And is that because those veins, especially when they get developed to where they're truly considered maybe a medical problem, is it pressure that they're putting on your tissue or muscles?
It's a little bit more complex than that, but what it is those veins aren't draining well. So the circulation in your legs really isn't good. It's not the blood going in. That may be absolutely fine in the arteries, but the blood that's supposed to empty out of your legs, which is the blood that no longer has as much oxygen. It's been taken up by the tissues. Now that blood is sitting there. So it's blood that has metabolites in it that perhaps should be emptied more quickly. It's blood that doesn't have a good oxygen-rich environment, and so it's just blood that you don't need sitting in your legs. The veins are overfilled, there's higher pressure, some of that liquid part can leak out, the serum, the clear serum, can make swelling in your legs, and that's what really causes the symptoms.
So then what do you do once you notice you have these symptoms? Because I'm assuming if you go to maybe your regular doctor, they're not going to say you have vein disease. They'll just say, oh, relax a little bit more, maybe
it's cosmetic. They may say it's cosmetic, or they may, tell you some other things. Many times doctors don't realize just how many symptoms people can have from varicose vein disease. It's a chronic type of illness, so it's not something that needs immediate treatment. It's something that usually is indolent, and is a nuisance more than an actual horrible symptom or pain. But it's something that can really interfere with somebody's lifestyle. They may not be able to do what they want to do because of their aching legs and tired legs.
And you don't want to pass off the cosmetic part of it too much, because I think for people that want to wear skirts or shorts or anything like that in the summer, I mean, that's a real thing that can affect your self-esteem and your confidence.
We agree with that totally, and I think maybe as women we tend to understand that a little bit more, whereas most people, when they go to their doctors, are told, well, it's just cosmetic, don't worry about it. And insurance companies don't recognize that cosmetic issues can be a true problem, so they're not going to cover that. But if you're symptomatic and you've gone through what they call conservative therapy trials, then insurance companies, for the most part, are very willing to listen to what we have to say and explain what the symptoms are and be willing to cover procedures to get rid of these varicose veins.
So you could get, depending on what your procedure is, this covered by your medical insurance?
I would say probably more than 90% of the time we get people's insurance to cover their problems if they've gone through the proper conservative therapy that is required.
And we were looking at some of the pictures before, and there are different, I guess, problems when it
Yes.
when it comes to your veins. You have kind of the lumpy looking
Right,
veins,
those are
and
true
then
varicose
then
veins.
the spider veins.
Right.
What are people's options? What are the latest?
Well, the
options?
latest things truly are what I think are the best things, because you don't need hospitalization. Things can be done in an office setting without general anesthetic. You literally walk in and walk out after the treatment. So people come in after they've been evaluated, and we do full evaluations at our center, including ultrasound evaluation of the legs, which is a roadmap. And that's really essential today in looking at the veins to know what the proper treatment is. We don't just go ahead and remove a vein we see on the surface. We want to know what the source of the problem is, and that ultrasound is going to help us understand that. So anybody with varicose vein disease should be evaluated with an ultrasound.
And then what can you do?
And then once they know what the problem is, the doctor should be able to sit down with the person and go over options. And that may include vein stripping, although we think that's a little antiquated and not something that's the best treatment. We really do more minimally invasive or non-invasive treatments, including endovenous procedures, which means putting something inside the vein to get rid of the vein. And that's a laser that we use, and the procedure takes about, from start to finish, it takes about 40 minutes.
Wow.
And the procedure itself, the laser closure, takes about 3.5 minutes. So it really is an easy procedure to go through, and as I said, it is walk in, walk out. After that laser part is taken care of, that's usually done in the trunk that's the source of the high pressure. Then the bulging, ugly veins will go down on their own, and anything that's left can be removed through little tiny needle holes.
And then there's a maintenance program too, I'm sure, after.
Well, about 20 to 25% of people with varicose veins will have recurrence of varicose veins, no matter what is done. But not everybody, certainly. And so, you know, then after the major problem is taken care of, the truncal issue, if there's spider veins or if there's smaller veins, they can be taken care of by all kinds of techniques that we have.
And nice to have these new options for people
Yes,
that
it
you
is.
talked about. And we had the information up on your screen if you'd like to get more information from the Wisconsin Vein Center and MediSpa. It's located in Pewaukee. There's a phone number there as well as a web address. Thanks for your time today.
Well, thank you very much.